Hello all viewers, myself Dr. Abhilash, Consultant Laparoscopic Surgeon at Himagiri Hospitals, Gachibowli, Hyderabad. In this video, we are going to discuss about hernia surgery and what are all the precautions to be taken prior to hernia surgery, or to put it in other way, nowadays we are getting multiple calls from who operated patients for hernia who got operated elsewhere, and they are calling us with their complaints like persistent pain over the operated site, or pus and discharge from the operated site, or non-healing of the wound, especially after open hernia surgery. And all these patients are being operated elsewhere at small centers for some unknown reasons. So in this video, we are going to discuss what is the significance of taking all the precautions prior to hernia surgery, and what happens if all the necessary precautions are not taken, or what precautions to be taken prior to hernia surgery. So to start with, hernia is one of the most commonly performed surgery worldwide. So in this hernia, as discussed in our previous videos, we do have two options for hernia surgery. One is open approach and one is laparoscopic approach. And in all our previous videos in our channel, we have discussed the advantage of laparoscopic surgery over open surgery, like less cuts, there won't be any cuts, major cuts, the maximum length of the incision when the patient undergoes a laparoscopic hernia surgery is 1 centimeter, and the rest of the incisions will be 0.5 centimeter. So the length of the incision is very small, so there won't be any need for any stitches or sutures to close the skin, and the incision is small, so the post-operative pain also will be less, and there won't be any need for bed rest as such, and patient can walk on the same day, patient can resume his regular activities the very next day. He can go home and there won't be any need for any dressings, or there won't be any need for follow-ups for stitches or sutures removals, and the return to activity will be much faster in laparoscopy compared to open surgery. So, okay, we have understood all the benefits of laparoscopic surgery over open surgery, but what are all the possible complications that can happen after hernia surgery? All the patients should know, so that they can choose the doctor or the hospital accordingly to avoid all the major complications if any mishappening happens after a hernia surgery. So what is the most dreadful complication that can happen after a hernia surgery is, as we discussed in all our previous videos, any hernia surgery, be it at the region of the umbilicus, or be it at the region of the groin, or be it inguinal hernias, or be it incisional hernias, all hernia surgeries over the abdominal wall requires a mesh placement, so that we be acting like an additional strength to the muscle, so that hernia won't happen again in the future. So in this process, we are placing a foreign body called as a mesh into our body. So what can happen if this mesh gets infected? Right? So generally, presume if we have any infection in our body, if we consult a doctor, what he or she will be giving? They will be starting us on an oral antibiotic or an injectable antibiotic, and this antibiotic gets into the bloodstream and reaches the site of infection, and this antibiotic will be killing the microorganisms over there, and bacteria, be it bacteria or virus, and thereby we will be cured of infection after taking the antibiotic. If suppose while placing this mesh, if infection happens, what possible complications can happen? So can we treat the mesh infection with antibiotic? The answer is absolutely no. We can't treat mesh infection with any antibiotic, how much powerful or how much costly it is. Why we can't treat a mesh infection with an antibiotic? As discussed earlier, the antibiotic which we are taking gets mixed into the bloodstream and reaches the site of infection and acts. But what happens if a mesh gets infected? Mesh is not our body part, it's a foreign body. So even if a mesh is inserted into our body, the mesh per se won't have any of our blood supply. So how much costly or how much powerful antibiotic we take, it is going into the blood stream and all, but it can't reach or it can't act over the microorganisms which are on the mesh, because mesh is a foreign body. So if at all mesh infection happens, the only and only treatment that is available is removal of the previously placed infected mesh. If the mesh is not removed, this infection may spread, thereby leading to spread of the infection, thereby complicating the scenario. So the only treatment available for mesh infection is removal of mesh through another surgery itself. So prior to opting for surgery, make sure that you are discussing all these points with your doctor. So preferably, if laparoscopy facility is available, always go for a laparoscopic hernia surgery over an open hernia surgery, because of all the advantages we have discussed earlier, and the chances of infection are much less compared to open surgery in laparoscopic surgery. And other than that, how patients can ensure this safety from the hospital is, if you are undergoing an open hernia surgery, please discuss with your surgeon whether the instruments are completely sterilized or not. What is this thing called as sterilized or sterilization? Sterilization is a process where all these medical equipment and instruments used in surgery are completely made free of all the bacteria and virus. If an instrument is called as sterilized, it means that the instrument is completely devoid. Not even a single bacteria or virus is staying on the instrument. So this process is called as sterilization, and we do have multiple methods of sterilization. If anyone is undergoing an open hernia surgery, make sure that the instruments, open instruments, are sterilized by autoclave or not. This is one method of sterilization. In the same way, we do have other methods of sterilization like ETO, ethylene oxide sterilization, or plasma sterilization. These laparoscopic instruments are a bit difficult to handle compared to open instruments in terms of cleaning and maintaining sterilization, because they do have multiple junctions or multiple fittings and all. So if you are opting for a laparoscopic hernia surgery, make sure with your surgeon and the hospital whether those instruments are completely sterilized or not, whether that hospital is equipped with ETO, ethylene oxide sterilization or not, or plasma sterilization or not. Unless until you don't have that guarantee that these instruments are sterilized, do not proceed for surgery, because even the slightest of mesh infection can cost a lot, both in terms of financial aspects and the time of you and your crucial life. Because once this mesh gets infected, he or she needs to visit the hospitals multiple times. That will be a nightmare both for the patient and for the surgeon also. So we at Himagiri hospitals, we 100% ensure that our instruments are completely sterilized prior to surgery, and this sterilization process itself, especially if it is done through ETO, the sterilization process itself may take 8 to 12 hours or so. And we at Himagiri hospitals, to ensure that this mesh infections doesn't happen, we always make sure that all the instruments are sterilized prior to surgery. And also we plan our operation theatre schedule in such a way that all the hernia cases are posted or planned or scheduled in the earlier half of the day, so that we have all the infected cases in the later part of the day. Because our aim is pretty clear, we don't want our patients to have any infections. Suppose if a patient in the same operation theater, if we do have a surgery like any abscess where pus has been removed or any pile surgery as such, we won't be posting our hernia surgeries on the same day because that operation theater is already filled with bacteria. So always we ensure that our operation theaters are completely free of all these microorganisms, especially if any hernia surgery, or for that matter not only hernia surgery where mesh is employed, for example knee replacements also, where the knee joint will be replaced by a prosthesis, some foreign body implant which is acting as a replacement for a knee. So all these surgeries where implants are used, such cases are to be planned in a clean OT, especially in the earlier half of the day. We at Himagiri hospitals ensure all these sterilization techniques, thereby our patients are completely free of infections and there won't be any nightmares both for the patients and for the surgeons. Thank you.